everyone, my name is Jen Elerlenida. For today's, I will going to perform the newborn care baby, which is defined as the management of recognize and of course the subsequent period of the stabilization. So wash your hands prior for preparing the material needed such as the cotton balls and also ointment and cord clip, measurement, syringe, and of course, sterile glove. So, afterwards, define the infant by proper looking at his or her name of waist to identify the infant, which is the name, to know that the patient are where to belong the parents of that. And on hand, the infants comfortable by keeping the environment warm to prevent heat loss that the pain result the hypertension, and to course perform hand washing during the perform. After we the newborn correctly so that we will have our baseline data. So I will going to proceed my perform for my procedure. First is I will going to identify that what is the identity of the patient. So now I will going to put the waist tag to the patient. So here. So now let's proceed to record dressing. So this procedure help us to prevent infection around the baby's cord stump. So put the sterile gloves then properly or sustain upper and lower extremities. Or the newborn using the operating here sponge with and disinfect the cord 3 times from base upward to hold the baby in a place and to gain the proper access or the cord, and always to protect the cord from contamination. So get discard. Get one. So now put the serial os of the base of the cord and clamp the cord with umbilical clip 1.5 and 1.5 inches from the base cord. So now climb and cut the cord using the plastic cord about 2 cm from the base of the pulsating stock within a 1 to 3 minutes after birth to prevent anemia and intravascular bleeding. I'll put cord about 1.5 cm above the cord clip and express the remaining blood. The cord with the place of base of. So now place the os of the base of the stump cord and 4 Stanley%. This to ensure that the remaining blood is stuck with the cord of the baby and to provide the most optimum condition for the healing by removing remaining debris to contaminant from the and around base of the cord. So now, starting with the head. Okay, it's also 22 centimeter. Now I'm going to measure the chest circumference. The chest circumference should be measured by placing the measuring tape under the armpit. However, my body doll arm has been taped 11. Okay, 34 centimeter now. I will go into the hips. Okay, 29, it is the centimeter. And also, lastly, for the newborns lang, okay, the baby is 34 centimeter long. Let's proceed to initial born football grip manner folding of air to maintain the comfortable. To enter through the air, then carefully wash the newborn head with the use of baby soap or mild shampoo. Wipes dry the toddler R4. So of the baby soap, the mild shampoo are prepared babies because they are unlike to cause irritation to baby's skin. So now put on the baby's diaper shirt, maintains and booties. So diapers are given to absorb and to hold the baby's waist, while the mittens and booties protect the baby's finger and toenails from the trauma and to prevent the baby from scratching his or her face. Then wraps the newborn security in a clean blanket to maintain the warmth, and of course place the newborn in a crib tag. So because the crime contained the drop, then I will put the Then exercising gentle pressure of the upper and the lower lids to protect the infant from the eye infection of the ophthalmum neutral. So now I'm applying the ophthalic ointment from inner to outer contus. So assuming that this is the ophthalmic ointment, so make sure that the tip of the medicine tube will not touch the eye, to follow the principles of starting from area from Curtis for view and to take the newborn vital signs, because vital signs are good indicator of the newborn adaptations survival, such as the temperature, heart rate, respiratory rate. Come on. So now, of course, lastly, care to maintain the cleanliness and record the procedure done and the other pertinent data, so the proof that the procedure was done and the communication among the professional of the health system through the exchange of the information that concern the patient. For that, I will going to pull out my gloves for my doing next to hand washing and documents all of my findings to my procedure. Sterile to sterile and clean to clean. Then, after done my procedure is I will going to document all of my findings. So what is the West the thermometer, the vital signs, and of course the tape measures or what is measurements of the patient, and also the baby is or are normal. So I will going to document all of findings.